Welcome to the office.
Hi.
Welcome to the office.
Thank you.
What brings you here?
My right leg has been having a lot of issues.
What happened?
I don't know if it's from exercising or from kids, having children, but the whole back of my leg, honestly,
So
goes all the way down.
when you're saying that, is it a traveling shooting pain?
Sometimes.
It starts in the back?
Yes. It starts like in my glute. It
So-
feels like it's my glute, but it might be the upper hamstring. And then all the way down.
Are you sitting on the
leg.
ischial bone, on the bone itself? Can you feel the bone?
No.
Like, if you feel the bone here?
Yeah, I can feel
Okay.
it.
Does it start above or below that?
Right about there.
Right about there?
Maybe right below.
Right below?
Yeah.
Okay. And it started when?
It's been a while.
A year?
Yeah, a year.
Your last kid was?
5 years.
5 years ago. Okay. And this started about a year ago.
This specific, yeah, a year ago.
Okay. And what position makes it worse?
Sitting at the computer.
So you're sitting for how long when you feel it? 20 minutes, 30 minutes?
Oh, the first 10 minutes.
First 10
After
minutes.
10, 15, it's like I feel it.
What about sitting at dinner?
Not usually, but maybe I'm distracted.
Okay. On the couch?
No, not so much on the couch.
And on the couch, are
Rare.
you leaning back?
Yeah, or usually
what's
I
different?
fold legs or
Okay.
yeah, not lead.
So
legs
if
there.
you fold your legs, you're fine?
Yeah,
Got it. Okay. We're getting some answers.
I think so. Yeah.
Okay. And not on the left side?
No.
What makes it better?
Folding the legs. When I'm exercising, it's usually fine.
So movement, standing, walking is
Walking,
okay?
I feel it though, and it kind of hurts.
You feel it when you're walking
Yeah.
for how long?
Just lately, it's been like all the time.
Okay. And from a seated to a standing position?
Do I feel it too?
Yeah. Sit to stand?
A little, but not notably.
And have a seat? More when you stand or more when you sit?
More when I stand.
More when you're going from a seated to a standing position?
Yeah,
Okay. What else is going on?
that's the biggest issue. I don't even feel anything else.
I'm sure it's been bothering you enough. And how did you hear about us?
A friend
A friend?
who watches your videos.
Okay.
That I've never watched.
Okay. So we have a newbie, guys. Okay. This is good. Well, let's figure out what's going on and let's start the journey. So there's nothing else that we need to go over for today.
No.
All right, and so what I'm going to do, I'm going to go over your x-rays. I took some special x-rays for you in the lumbar spine. So normally, and most of the people know when we're doing full spine analysis, the Gonstead method is based on the full spine approach. I know you're having shooting pain down the right leg. I check everything.
Yeah.
I've had at least 60, 70 cases now of sciatica type symptoms coming from the neck.
Whoa.
Yes, so
Okay.
anything can cause anything. I've had headaches get resolved with the pelvis adjustment.
Okay.
Okay, so the point is we want to check everything specifically. What you're complaining about is you're telling me you're getting something from here that's traveling down. And so you're presenting with the classic sciatica type symptom,
Right.
not diagnosis.
Right.
Sciatica started as a symptom, it became a diagnosis. On the side profile, and the first thing we see here is we don't have the curve in the low back. We're designed to have this type of curve. This is the front, this is the back. Okay? And 60 forward, 60 back, 60 forward. When we have the right curvature or close to the right curvature, that is our primary line of defense against the forces of gravity. I know you're standing, it's hurting. And the reason when it's hurting when you're standing, look, you carry your upper body behind your foundation. This should line up. The neck should line up with the hips. So this should line up with this. When you're standing, you're slightly behind. And so as a consequence, and part of the work is you're developing a slight reversal of the curve in the upper neck.
Ew.
And so I know you get tightness and stuff up here too. We haven't discussed it yet, but
Okay.
I know you
I'm
get
sure.
it. Okay? Now, the good news is you have great discs. L5, L4, L3, L2. L1 is turned a tiny bit, okay? Tiny bit. And you can see, this is actually interesting. L1 has a little tiny spur forming there. So what that tells me, you had instability up here. So you're working out pretty consistently, right?
Mm-hmm.
And if you don't feel good.
Right.
Yeah. The workout keeps you together.
Mm-hmm.
Body, mind, and soul.
Yeah.
That's what I get
Mhm.
from you. Okay. And if you don't, everything starts to kind of
Yeah.
Is that right?
Uh-huh.
And when did all this start? When did the consistent working out start? Something happened
Yeah,
you're not
Andy
talking
was
about.
1, so 4 to 5 years ago.
What about before kids? No issues? Zero? No accidents? No traumas?
Oh, no.
Zero? Nothing?
Right. Then I had 3 in 3 years. It's a lot of trauma.
Natural?
2 natural and the 3rd was a C-section.
Because?
He was breech.
So between the
And
second...
there was a lot of issues after him.
Yes, so between the second and third baby is when things changed.
Okay.
That makes more sense.
Okay.
Because usually when I've seen breech presentations, it's usually from a rotated pelvis and rotated sacrum more specifically. So do you remember if the head was more on the right side or the left side? It's kind of important. You don't have to answer
Probably
it now.
the right.
I'm assuming.
I don't know. I
Okay,
don't remember.
No worries, no worries. Let's move on. Okay, she's here for sciatica. Okay. All right, let's
I
continue
mean, I have
on.
no idea.
This is great. These discs are all great. These discs are good. This one around the middle of the back between the shoulder blades, that's the digestion area. Something in here around this area that we're going to talk about in the exam. And as we go up, you had some surgery?
Oh, I did here.
Staples.
Yeah.
Okay. All right, now let's look at the neck. When we look at the neck, again, we should have that forward curve. I see that this is a little close, the occiput and atlas there. There should be a little more space there. Now, let's go into flexion extension and see what happened. This is neutral. You have great extension in the neck, but let's see what happened in flexion. And here's an answer. So when you go in flexion, that didn't open up. You have something upper cervically now. Something is hiding up in there.
Like what?
Nerve pressure.
Yeah.
I'll explain as we get. So,
Like what's hiding?
so what's happening is this. Look, this is the side profile, okay, of the neck. When we extend, everything closes up in the back. When we flex, it should open up.
Okay.
This one doesn't open up.
Okay.
So it's stuck. The question is it the atlas that's stuck or is it the occiput that's stuck? We'll do it on the exam and figure it out, okay? This is all great, by the way. Discs all go forward, all look good. Now, I did do flexion extension of your lumbar spine specifically for a reason, because you were talking about sciatica type symptoms. Is it coming from the sacrum or the lumbar? It can come from L1 all the way down to the sacrum. It can come from the upper cervical as well.
Okay.
Okay, so this is your neutral position. I do see a couple of old tailbone injuries you did have. Okay, when we're looking at the angle of your sacrum, instead of being like this, it's angled up. So whatever happened here, you had a couple of good tailbone injuries growing up.
Oh.
You did.
You don't think it's from the babies?
That's not babies. No, that's not
Oh.
babies, man.
Oh, falling.
You had a couple of good falls.
Yeah.
Good tailbone falls.
Snowboarding too, maybe. Some falls.
Flexion. They should open up. This one doesn't open up. This one opens up. This one opens up. Same thing like in the low back, in the cervical spine, same thing should happen in the low back. When you go in flexion, even this opens up, the S5 coccyx. This opens up a little, this opens up more, this opens up more, this and this don't open up. So the question is it coming from sacrum primary or is it sacrum L5 and L3? In extension, this one didn't really go back, these went back. So 5 is stuck. The first floor of your building is stuck. There is something going on there. But I'm going to start in the basement. If the basement foundation ain't right, first floor is not going to hold. Does that make sense?
Yeah.
Okay. All right, let's get some answers now, okay? This is the pelvic analysis that we do. And what it shows, we actually have a rotated sacrum on the right, on the side of what's called an ASI and ilium. You have a slightly short leg. 5 MD measured difference means your right leg is 5 millimeters lower than your left leg. If I work on your pelvis, I make it worse. So the answer is not that. The answer is your tailbone. It's coming from sacrum primary and possibly L5. Let's get started. You have any questions on this?
No.
Okay, we're going to do the exam now. I'm going to watch you walk. We're going to do a gait analysis. Then we'll do the physical exam. First thing I want you guys to see here and for you to know, this is inflammation from a sacrum being out. Okay? It's starting here. And we're going to watch to see how these move. When you walk, these should move up and down. Before we get there, what do we see? We see a slightly right high shoulder. And this is what I was talking about. Check this out. So this is inflammation. We don't really actually see the dimples. We see the indentation to 4, and then what happens? We see the spinuses here, then they disappear again. We have the dishing going through here all the way up. So we need more curve in your spine. And I'm going to talk about the exercises and things you're going to need to do to develop your curves.
Okay.
Fair enough?
Yeah.
All right, let's see the catwalk. Walk to the
So
corner.
just walk.
Just whatever your walk is. And you're coming locally from the west side.
Yes.
But you grew up in?
Texas.
Texas. All right. Keep walking, please. And you're going to do that several times. So she got the Texas wiggle when she walks. I'm going to refer Texas, sorry. Okay, we're watching the dimples instead of going up and down. It goes up on the, they go up, but they shift side to side when you walk.
Popping a lot right
Yes.
now, but.
How long have you been, just right now you're popping a lot or in general?
Yeah, no, just right now I think.
Sure. Just keep walking. And that sway that she's doing is the short leg on the right side. Keep going. Okay, and I want you to be mindful of how it feels to walk right now, okay?
Yeah, I mean, not pleasant.
Yeah, and see here, let's get started. So it's not very common lately that people come in from a referral and have not seen any videos. It's kind of
I don't wanna know.
It's kind of a little weird for me, guys, you know? And you're the second one in the last couple of days, but it's also cool because we're going back to basics right now. Let's go ahead and run the meter on your back. The meter we're running is measuring the inflammation. It's a mini thermography unit. It's going to feel like 2 fingers running down your spine. I do this on every visit, every patient, pre and post adjustment. My job, so wherever there's inflammation or pressure, it's going to go to one side and come back to 0. My job is to find where that is, determine how to correct it, and 0 everyone out.
Okay.
That's my job. Clear the spine. Okay, starting at the base of the neck. And the first thing we're getting, actually we're getting heat to the top, and we're getting 15 points left side, 17 points left side, atlas, maybe occiput. Going to determine that on the exam. Let's go down the spine. We've got a little bit of heat going to the left. Now it starts to pick up. Picks up, picks up. 10 points, but wait for it, guys. 10 points, and then switches. S4, left, right side. A little bit there, but it's switch. And if we run it a few times, it will switch. And that's where it is. S4, S5. And I'm getting the basement and the penthouse. And as we're running the fingers down the spine, you can see right there more of the swelling. Right there. This part's not happy. There's a lot of compensation there. And that goes all the way into that side right there. Now let's check the right side. A lot of inflammation here, a lot of inflammation on both sides. Let's check the movement of the pelvis. Feet together, scoot forward please. Open and close the knees with the feet touching. My fingers are on the top of your iliac crest and right here on the hip. When she does the right, the whole left wants to shift. Left side only. When she does the left, the right wants to shift too. Right side only. Interesting. Scoot back for me please. Now back slowly into extension. That's 5. 1. 1 is tender, I know.
Yes.
And 1 on the right is that rotated right sacrum. But we got to go down more. 2. Yes.
Yes.
3.
Yes.
And 4.
Yeah. Yeah.
4 is the worst? Or 2 is the
No,
worst?
I think like 2.
2 is the worst?
It was all bad.
Okay. Well, no, tell me which one is the spiciest. Come back slowly. That one
No.
or that one?
That one.
That's
Yeah.
S2. Oh, ho, 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 ho. 7, 6, 5, 4, 3, 2. That's 1 on the left. That's 1 on the right. That's more muscle tension. So we got to go up to the occiput. We're going to do nodding of the head this way, okay? Primary motion of the occiput is nodding. Primary motion of the atlas is rotation. Our rotation is decent, a little tight on the left side, but not too bad. Now, let's check the nodding. Right side, left side. That's it, man. You feel that on the left versus the right?
Yes.
It's right there. It's hiding up top of me.
Yeah.
It's up in the penthouse. All right, let me go to the x-ray and figure out the misalignment and what we got to do now. And then I'm going to give you our game plan to start today, okay?
Okay.
And after we get some relief there, if you want me to deal with your jaw and your septum, I'll do that as well too, okay? And so today will be spine, and I will be working on your ankles today too.
Oh, okay.
Okay? So here's the interesting part when we look at the occiput here. There's the condyle right there, the occiput. And when I'm looking at it this way. So check this out. It's closed in the back there, open in the front there. So it's kind of misleading here. If we look here, so if we draw this atlas plane line right here, it looks like it's all, if we compare atlas to C2, it actually looks like an AI, atlas anterior inferior. But when we draw the occipital line, it's PS, okay? And I'm going to remove this now. There, it's jammed in the back this way. Let me show you. This is what's happening. This is your upper cervical mechanism. This is the back of the skull. What I'm showing is, you see these condyles right there? This is the motion, which is nodding. Yeah. Atlas C1 is rotation. So yours has gone back, and then it's wedged on the left side. We're going to start with your occiput on the left. After that, you're going to sit and stand a few times. And if you want to test it out real quick, sit and stand a few times, see how it feels on your right hip, on your right leg. Just sit and stand a couple of times, just see how that feels. Okay? Yeah? Okay. Have a seat. And let's go to the left occiput.
Which I just relax?
You just relax there. I'm going to be contacting here. I'm going to go through the motion. I'm not adjusting you. I'm just going through the motion.
Okay.
So I'm going to be bringing laterally flexing you over. This way to the left. I'm not thrusting, I'm just showing you. And the thrust is going to be that way. That way to open it up. Okay? Mm-hmm. Cool? Just like that.
Okay. Thank you for doing that quickly and not telling me.
Walk it up. So, sit and stand a couple of times. See if anything is different so far.
I mean, it does feel nicer.
Walk it off once, please. One more time. Should be a little different.
It is a little different.
Can I open it back and see?
Yeah.
Walk it off. It's actually a lot different. You'll see. Okay, have a seat. And let's do that sacrum. And the way we're going to do the sacrum, we're going to do it as a rotated right sacrum. And we're going to do it left side down. She's here. We're going to set it as a rotated sacrum, pisiform contact, pisiform on the right sacral ala. I'm going to roll you towards me, right there. There. Good? Gotcha.
Thank you.
You're welcome. Come up
It's so scary. Jesus.
That's the worst of everything, okay?
Okay.
Walk it off now. Check it out.
That does feel nicer.
Turn around, let me see, please. Walk it up. There you go. Back over here and have a seat, please. Let's run the meter on the back. Neck is clear. That's pretty cool, dude. Sacrum is clear. Let's recheck the motion. Scoot forward again. Open and close the knees. Feet touching. Open and close. Good. Right side only. Good. Left side only. probably need to work on that hip later once we get your sacrum sorted out. Shoulders. Let me do the work. I'm bringing it back towards me. There you go. Back towards me. There you go. Go on your back. This was an old ankle sprain. Right there.
Oh, awful.
That one, not so bad.
Right.
Right side. Shall I work on that for you?
Okay.
And that relates to, so whatever your injury is, we have a rotated sacrum on the side of a rotated pelvis. ASIN on the side of that predisposes medial knee pain. Do you have any knee issues?
Yeah, late, more so lately, but normally I didn't before.
Right there.
Just.
Backside. We'll deal with that later, okay?
Okay.
I don't want to touch a knee first visit with the adjustment of the back.
Okay.
Periarticular swelling, working as much as you'll allow me to. I'm getting rid of as much of the swelling and
Yeah. Oh, God, that's. Jesus. I thought that was the end of the pain.
there. If it's too much, tell me. I'll stop. But I need to do this to fix it. She's like, I'm past it. 5, 4, 3, 2, 1. Now, passive range of motion. Shasha! I need a second set of hands. Shasha here, she disappeared. There she is! Hi, Shasha! Alright, I need you on this side. I need you to lift her leg up for me. And I'm going to set the ankle. Good. AS talus, medial tilt. Relax your hands. Relax just lift up. There you go. Thank you. Now we're going to use the speeder board. AS talus, medial tilt. Posterior fib. There you go. One more time. There you go. Okay, you can put your sock on, walk it up. And then we got one more thing to do for you. And as you're walking, tell me if anything is different. You've been adjusted.
Yeah, I mean, it feels better. Even my ankle feels more open, I guess, if you could say that.
Mm-hmm. Let's sit and stand a few times.
I mean, the leg feels much better.
It does,
Yes,
right?
yeah, much.
Sit and stand a few times. Keep going. So for this week, I don't want you doing weights, please. You can do all the cardio you want. I
The
know.
whole week?
Yes, ma'am. You want this fixed?
Yes.
So for this week, you can cardio. You want to get some resistance,
Yeah.
throw a backpack on and go climb a hill.
Okay.
You do
Wow.
weights, then you're wasting your time here right now.
Oh.
Because I have to fix the imbalance.
Okay.
I don't want you strengthening an imbalance right now. That's what you've been doing this whole time.
Oh, interesting. Okay.
Please.
Okay.
Okay?
Okay.
Does it make sense?
Yeah.
That's why I saw and I said to
Even
you,
upper.
nada.
Okay.
Capiche?
It's good to know.
Listen, but I need you to understand why.
Yeah.
I need everyone to understand why. Because you have this imbalance, you've had it for a while.
Yeah.
Okay, before even kids even.
Yeah.
However, your workouts are what kept you going. Now, we need to fix the imbalance so when you go back to your workouts, it's even better.
Okay.
Okay?
Mhm.
We're moving forward.
Okay.
We're not moving backwards.
Okay.
Please. Now, sit on the floor, please. That should be a little bit easier.
Yeah. Yeah. I sit on the floor a lot.
Okay. Stand up quickly. You're going to try to sit without crossing too much though, okay? Just to get a feel for it.
Okay.
Okay. Have a seat, please. You good?
This tickles, so yeah.
Tickle spice, right?
Yeah.
Some are spicy.
Between
some-
the shoulder blades. Oh, and that whole line.
Tickle spice.
Yeah. Tickle.
Tickle's good.
Tickle.
Tickle's good. Tickle's good. Is that one of your defense mechanisms too? Ears. Okay. And last thing is the hands. Stand up. Squeeze the hand. Squeeze hard. Squeeze hard. Okay, relax there.
Jeez.
I'm tuning you up. I'm dialing you
Yeah.
up. Squeeze.
Okay.
Relax there. You're strong. There. You're strong.
Yeah.
There you go. Squeeze. Squeeze. Questions for today with anything I found?
I don't think so.
Welcome to the office.
Thank you.
You're welcome.